Hi, everyone. Thank you for joining us today. Welcome to the Wellbeing Matters. If you're new here, the Wellbeing Matters mission is to advocate for optimal health and also to share evidence-based resources with our community members and attend to their nutrition education needs. Dr. Kudchadkar is here, and I would like to introduce our guest. Um, Dr. Kudchadkar got his medical degree license from KLE University in India and completed his PhD in nutritional sciences at Texas Tech University. As a clinical nutritionist, he has worked in various clinical trial investigations and about three and published peer review articles in prominent journals like the International Journal of Obesity, Nutrition and Diabetics, the Obesity Journal, as well as his expertise spans from not just body composition techniques, but metabolic testing, obesity management, and also using lifestyle approaches to manage and treat health conditions such as diabetes and um, heart diseases, but he is also a postdoctoral researcher at Texas Tech University, specifically at the Nutrition Metabolic Health Initiative Clinic.
Thank you so much, Mary, for the kind introduction and very deep address what diabetes is, who all are at a risk of having diabetes in the future, then what are the practical nutrition approaches, and please note down questions as I go through my slides so we have enough time to discuss towards the end. As we all know that diabetes is an epidemic since the past so many decades, and it's a growing disease out there which touches almost every family, and healthcare systems are even still now struggling even though they have a lot of medications and prevention strategies, and it is now rising at a very younger age, which is linked to lifestyle, environment, and other social determinants of health. But the good news is there are many drivers of diabetes that are modifiable. So here are some of the stats of diabetes as a disease worldwide. So why focus on these early age groups, that is within 20 to 50? These are the prime decades of work and caregiving where you have less time to do your own self-care. So that is why we need to understand why early prevention prevents the decades of complications to arise in human life. So small changes now can help you compound your metabolic health in the long run. So as we know, obesity is a multifactorial disease which comes with increased adiposity with a high BMI above 25. And with that comes type 2 diabetes in a very early age. So most of the population that are affected are women as compared to men, because women have a lot of ups and downs in their whole lifetime period with changes in hormones during their puberty, then pregnancy, and then post-menopausal phase. And due to the amount of caregiving that they are involved in due to childbearing and other family-related stresses. So prevention now will allow you to have a healthier decade in your later life. So what is diabetes? We have three types of diabetes that are known. One is type 1, type 2, and pre-diabetes, which puts you in a window where that really determines your lifestyle, determines at what age you may be having diabetes. It's like a prediction window period. So type 1 diabetes is autoimmune, where your own immunity fights against the cells that produce insulin. Type 2 type of diabetes is the one that comes with insulin resistance, where the cells are not able to absorb insulin. So the amount of work that your pancreas, the organ that releases insulin, has to work more, and there's impaired insulin secretion. And pre-diabetes is a window where your glucose levels are high, and the compound called HbA1c, which is used to detect the incidence of diabetes, is high. But with all these given, prevention and management is still possible. The third one is gestational diabetes that occurs during the stage of pregnancy, which affects 6 to 9% of pregnant women, which raises the risk for mothers and the baby to have type 2 diabetes in the future, which can again be prevented using healthy eating and frequent follow-ups with your PCP. So pre-diabetes, as I mentioned, is a window of opportunity. I look at it as like the yellow light at a traffic signal where it gives you enough amount of time to decide whether you need to cross, or once it's red, you're in trouble. So lifestyle programs are, I would say, the key during this yellow light to cut the progression which occurs substantially in your age as you grow older. So the action steps, I would say, research based are screening, weight management, and consistent physical activity and stress care. So they've shown that used in this window period that you still have 25 to 50% risk of having diabetes in the future within the 3 to 10 years period. But lifestyle change during this phase can lower it by 58% lower risk. And DPP trial, that is a diabetes prevention program trial, has shown that the adults who are more than 60 years of age have shown a 70%, 71% reduction in their state of having diabetes. Key risk factors of having diabetes, there are two categories. One is non-modifiable, the other one is modifiable. In non-modifiable, as we know, we have family history, age, certain ethnic backgrounds, personal gestational diabetes history, which is not in our control. But we have modifiable risk factors like excessive weight or inactivity, your dietary patterns, poor sleep, chronic stress, smoking, alcohol, and some other comorbidities that may come along with it. That is hypertension, dyslipidemia, polycystic ovary syndrome, and some medications like steroids can also raise the risk of having diabetes in the future. The American Diabetes Association has listed out their standards of care, where they've made it compulsory for patients to who are in the pre-diabetes phase to have annual risk-based screening, and more frequent if they have all these key risk factors which are high. So they've designed their guidelines in a way where individualized glycemic index needs to be targeted and consider patient preferences in terms of diet and their comorbidities and so on. Weight management is very integral to diabetes care. How I look at it is increased weight or obesity could lead to diabetes instead of the other way around. If you have diabetes, you may not gain weight. So you may have silently had diabetes, but just because you've not gained weight, that doesn't mean it cannot be harmful for you. That's why we have a lot of team-based care right now. There's a lot of social media out there uh, showing us a lot of evidence-based care that are out there. But as we see that there are medications coming out for weight loss and obesity treatment, there are no alternatives to lifestyle change. The medications and surgery options that are out there are just a supplement that can help you to stick to your lifestyle. So the power of weight loss is very substantial in terms of the good effects towards diabetes. So just about 5 to 10% of weight loss. So let's say a person weighing 200 pounds, losing about 10 to 12 pounds can help the person to lower fasting glucose, improves the HbA1c levels, and improves the cholesterol and blood pressure and markers like that. So I would say over here, we need to focus on the numbers and just not being perfect all the time. So even if you have a small amount of weight loss, like 3%, you need to celebrate those wins. So there are a lot of nutrition-based, evidence-based approaches out there. Research has shown that the Mediterranean and DASH diet have reduced almost 31% of future diabetes risk. The key foods that are included in these clinical trials called pre-time, they included veggies, options like legumes, nuts, fish, olive oil, and so on. So the carbohydrate quality in these diets are they matter more than what the diet is about. So all these things allow you to plan your meals, shop going and out shopping with a list, and building realistic goals and routines. So this is how a healthy plate should look like. Half a plate should be filled with vegetables and fruit, which are non starchy. One fourth of your plate should have lean protein. The rest, one fourth, should have whole grains and starch. And as they say, while you're eating your meal, water is the best drink for you. So, what are the foods to limit? Though I'm using the word limit because overnight someone cannot just stop drinking all these things or eating all these foods, right? Since we have one lifetime, people are out there to try out all these things and eat them in moderation. So the ones that you may have to limit are sugary drinks, juices, ultra processed snacks like wafers, chips, refined carbs like white bread, pastries, pizzas, and excess red and processed meat also need to be avoided. With this, I'm trying to say that we can replace this with other alternatives out there. Besides that, we also need to look at our physical activities and rather focus more on the numbers than the amount of intensity. And there are several options that we have. The setting goals like 150 minutes of workout every week should be more than enough to get you your weight loss goals. Then adding at least 2 days of weight training every week, a break from if you have a job which involves sitting in front of a computer or things like that, make sure that you at least get some break from every 30 minutes from it, and maybe walking around also helps. So I'm going to focus more on how women how diabetes as a disease affects women more. Like I mentioned, they have a lot of ups and downs in their lifetime when it comes to pregnancy, menopause, which fluctuates their weight up and down, and the amount of caregiving they have to be involved in their phase of pregnancy. So they have less time to focus on their own health. And diabetes during pregnancy doubles the future risk, as I said, in the future. And other condition that I wanted to mention was the polycystic ovary syndrome, which needs to be screened at a very early age. I would say in the late teenage. And when it comes to menopause, that arrives around the age of 45 to 50, shifts your body composition in terms of accumulation of fat, because that is the time where the estrogen hormone, that is the female hormone, uh, progressively starts decreasing. So that is when you really need to incorporate resistance training or a high protein diet, which still allows you to produce more estrogen in your blood. And also considering the amount of cardiovascular risk, that is heart disease, the incidence increases as the women have passed the menopause phase. So we need to advocate for that, considering comprehensive care. Several factors like stress and sleep need to be considered. Stress hormone raises glucose. Chronic stress fuels cravings for food. So I would consider at least having 7 to 9 hours of sleep with a consistent schedule, which helps to improve your body's insulin sensitivity. So at an early age in women or people who are more prone to having diabetes should be screened for their stress levels, cortisol, the amount of sleep. There are sleep studies which test for a condition called as sleep apnea whenever appropriate. Mental health is a condition which has a bidirectional relationship with diabetes. So routine screening is a key. Using of motivational interviews, coaching, which is focused on autonomy and small goals of a person, really helps. And normalizing this help, because there's a lot of stigma behind obesity and diabetes. So counseling in peer groups or having digital support systems out there is very beneficial. So how to go about that? You all might be thinking, oh, how can we just do this overnight? I would say setting smart and small specific goals which are measurable, achievable, which are relevant and time bound. Like you can start with adding veggies, or like starting walking 10 minutes every day. Start with 2000 steps at least, then 5000, and progressively increase, and then start tracking these, because we have several measurable devices out there which can allow you to set your weight loss goals and keep you accountable at the same time. And track what matters, that is your steps, meals, sleep, and stress, without obsessing about it. So one day you can start with your steps, and then when you see that your steps have gotten in, focus on your meals, then focus on your sleep. So plan for these lapses, and always seek for help out there. There are PCPs, nurse practitioners, dietitians to correct your courses. And even if you have to start over, you need to reach out to your healthcare providers, because there's a lot of education out there that people are lacking at this point. We also have a lot of community and support systems out there. The diabetes prevention programs helps the community to boost their adherence towards the program. So I would recommend enrolling in these community-based programs, which leverages family support as well, and also allows you for several workplace wellness programs and things like that. So all these, they address food access, cost, environment, and healthy changes which are feasible. So, looking at the evidence as a glance, lifestyle interventions have shown to improve the HbA1c levels, weight, blood pressure, and the quality of life. And combined approaches like nutrition, activity, and focusing on your sleep have really shown to reduce your risk by almost 58%, with 5 to 7% of weight loss alongside. So personalized intervention, because every body is designed differently, personalization is the key to treating the comorbidities that come along with diabetes. ADA has also set up a guideline on how people having weight issues need to be discussed very respectfully to avoid the stigma, ensuring privacy for measurement of weight, and talking about it very comfortably, helping tracking weight very periodically, the waist circumference, and choosing the best fit approach for all people, because as they say, no one size fits all. So let's continue moving forward with a very practical implementation. The medical patient, for example, we have the GLP-1s out there. Medications are not for everyone. We need to assess the individual's whole physical examination and then make sure which is the right fit for the right person. So as and when life gets start getting busy, as I mentioned, in the age group of 20 to 50, all these things need to be considered. So you need to follow up regularly, adjust your plan based on all the data out there and your lived experiences in the past. Know your body well. So the key takeaways that I would say is screen early, act on pre-diabetes rather than waiting for diabetes to arrive. Small changes, as I mentioned, give big results in the future, where you focus on nutrition quality, movement, sleep, and stress. Weight care is diabetes care. So personalize your weight goals, seek for support. You don't have to do this alone. There are programs and a team that allows you to stick to your goals and focus on the support that's out there, and do not focus on being perfect. So, just briefly, this is our facility in Texas Tech University, where we do evidence based coaching, body composition testing, provide support, and also do research. We ask about their referrals, programs that people are in, and use follow ups that fit your schedule. And we partner with the community. Health is in your hands. So, I would say start today. And I